During COVID, because a lot of our clinics got shut down at outpatients department, we're only seeing high priority cases. I came out to the front desk where I've been screening patients for COVID and asking anyone that was coming into the hospital questions regarding symptoms of COVID and also taking their temperature. It's really important that we can contact trace if necessary. Mostly it's been a positive reaction and people are actually really understanding of why we're doing this and that it's to keep people safe.
When somebody comes into the hospital that's suspected of having COVID, we normally don't do anything until they've left. So once they leave, we do a deep clean, which is like a full clean of the area that they've been in. We use some sprays which has got a disinfectant solution in it. We use the Clinels, which are disinfectant wipes. And once we've sanitised everything, we steam clean it with the steam machine.
During COVID, I've been preparing furiously with my colleagues in our department to prepare us for the eventuality that we might get an influx of very sick patients, because we actually look after the intensive care unit, and we're the specialists that actually deliver the ventilatory care, so it's supporting people's breathing and cardiovascular system when they get really sick. I'm originally from the UK, and I moved here in 2016, and I have a lot of friends and colleagues who work in the UK, and obviously my family, my parents both live in the UK, and seeing the whole COVID pandemic unfold, obviously in China and then the US and the UK, has been pretty horrifying.
With the onset of COVID, we had to re-establish how we worked within the emergency department to make sure that both staff and patients were safe. We set up what is known as the green zone and the red zone. The green zone is where all patients that come in who are unwell but do not have any respiratory symptoms or have don't have a positive screening for COVID, as against the red zone, which is where we take people with respiratory illnesses or those that are immunocompromised to keep them away from any other person that may be unwell so that they don't contract anything.
I will remember that the time of when it was all announced and we were ready to be locked down is feeling anxious, just like every other person in the community and the nation, but how our workforce responded to that and how quickly things got put in place to ensure that our patients and our staff can do the best that they can for our community.
During COVID, I've been responsible for managing 2 different wards included in the medical unit, which is Ward 5, which is for our isolation patients, and Ward 8, which has the majority of our other medical patients. Huge changes which COVID has brought around, looking at our infection control better, making ourselves question how we can look after people better, safely, including staff, looking at our training for infection control and things like that.
I'm Mandy, I'm one of the emergency department senior nurses. Primarily been doing some triaging and working within the red zone in the emergency department. We look at their health history, their presenting complaints, what's going on with them, give them an appropriate triage score, and then they get seen by a doctor. If we're suspected COVID or respiratory illness, they're isolated around into the emergency or the ambulance bay and kept separate from everybody else.
Working in the red zone's been exciting and kind of nerve-wracking, just with hearing a lot in the media about healthcare workers getting unwell, but we've got an awesome team here and everyone's been supporting each other, putting our PPE gear on and supporting people, making sure that we stay isolated when we are in there and keeping the bugs and whatever in red zone. I was anxious initially in the start there, but as time has gone on and we've seen how the numbers have stretched out and how well Te Tairāwhiti has done in regards to numbers in COVID, yes, really ease the anxiety and making it a more enjoyable place to work.